Hello, this is Dr. Grant Cooper from Princeton Spine and Joint Center with your daily crazy patient story and, importantly, the lessons that we can all learn from it. So years ago, in fact, I think it was about 10 years ago, I had a very nice patient who had been to a bunch of great doctors for her lower back pain. At the end of all of it, she hadn't gotten better, and she was scheduled at a very prestigious university teaching hospital in New York for fusion surgery. And she was coming to see me as basically a last-ditch effort to see if there was anything else that could be done so that she could avoid the surgery. So I reviewed her records with her, and I frankly agreed with everything that had been done to that point, right? She had gone through a very good standard complement of conservative care. I personally knew many of the doctors and the physical therapists that she had been working with and that she had seen. They were all excellent. I knew the surgeon that she was scheduled with. He was excellent. In short, she'd been given great care. It hadn't worked. And now she was scheduled for the next typical treatment, which was going to be a fusion surgery for her lower back. So I explained all of this to her, but I told her, look, we could always try something, right? There's always something else that you can try if she would like, but that she shouldn't get her hopes up, because everything else that she had tried up to that point had been higher yield, and what we would try from then on out might work, but each thing that we could try would be lower yield. Still, you never know what's going to help someone, and she wanted to explore all her options. So that's what we did. And what I did was I sent her to another physical therapist, and I told them to focus on her thoracic spine and her thoracolumbar mobility, which hadn't been the focus of the previous two places that she had gone to for physical therapy. And the therapist agreed, and we were all on the same page. Long story short is that this approach turned out to be a home run for her. And she started to see dramatic, immediate improvements to the point that certainly surprised me. It surprised her therapist. It surprised her. And in the end, it was so successful that she was able to cancel her surgery. Within a few months, she was basically 100% better. And she's still doing great, which I know because I still see her from time to time for other aches and pains, but not for her back. She keeps doing her exercises that she was given at the end of her therapy, and she's still doing great in terms of her back. I bring this story up because it offers us a few useful lessons. First, sometimes you have to think a little outside the box, particularly with exercises, if the more common things aren't working. Now that said, the truth is that this patient's success story was really remarkable, right? It wouldn't have been surprising if the therapy that I had sent her to hadn't worked at all, right? That would have been, we would have had to accept that. So lesson number 2 is that if you're interested in finding a way forward through your pain, and if the traditional highest yield therapies aren't working, if you have the patience and the determination to find another way, then you might find it. But you also have to be ready for one way not to work and then go looking for another way. So sometimes that might mean a new exercise approach, or it might mean using an alternative treatment like acupuncture or regenerative medicine techniques like PRP. Personally, I think the important thing to think about is that if you're going to pick an alternative treatment approach for a particular pain problem, then that therapy, one, must have a rationale for why it might work, and 2, it should be safe, right? So that is, if it's a low yield thing to be doing in the first place, then don't do risky stuff. And if there's no reason to think that it has a chance of working in the first place, then don't waste everyone's time. But if it hits both of those marks of having a rationale for why it might work and also of being safe to try, then you may want to give it a try. But you also have to remember when you're doing this that if you aren't seeing results, then remember you may have to stay a little bit nimble and move on to another approach to see if that's the one that's going to work the best for you. Okay, that's our video for our crazy patient story and the lessons that we can all learn from it. I hope you've enjoyed the video. If you have, then please like it and subscribe to the channel. And as always, if you have any questions that you would like for me to answer in a future video, or if you have any comments, you can reach me at drcooper@princetonsjc.com, or feel free to leave a comment or a question in the comment section. Thank you very much.